I'm going to call the July the 6th, 2010 work session of the Board of Commissioners to order. One thing before we get started into our actual meeting, we're in their meeting, but I would ask that everybody take a moment of silence to recognize the passing of a family member of one of our employees, Lee Suggs' son, 2-year-old son, Smith William Suggs, passed away on Thursday at a relative's house. And we certainly want to send him our best and let him know that our thoughts and prayers are with him. So if you would bow with me and give him a moment of silence. Thank you. We have before us our agenda, and we do have some supplemental information which is on the back. I would ask if everybody would look at this, and as it relates to the consent agenda, if we can have a motion to place the consent agenda items that are on our calendar here for the July 19th, 2010 meeting for the consent agenda.
So moved.
We have a motion. We have a second. We have a second. All in favor say aye.
Aye.
All opposed. And for the agenda that we have today, we can go straight into new business, which is G1, and that is found on page 90. And this is the Cabarus Health Alliance impact of healthcare reform on the Cabarus Health Alliance, the timeline. At this point in time, I'd call on Dr. Fred Pilkington for the presentation and anybody else that he needs to assist him. This is a topic, I want to refresh the board's memory. This is a topic that I believe at our last meeting we discussed that it would be important, or 2 meetings ago, it would be important for us to hear from Dr. Pilkington about the Health Alliance and how it relates to the county in relationship to the healthcare reform. So at this time, I'll turn it over to Dr. Pilkington.
Thank you, Mr. Chairman. I have with me Dr. Russ Suda, who's our medical director, and Mr. Charles Phillips, who's our chairman of our board. Is the presentation on there, John?
We have.
I don't have it with me.
Is that what you'd like?
Yes, I'm going to start out. The chairman had asked me to talk about several concerns that the board had. So we've got essentially 3 different presentations. One of the questions that he says the board wants to know some information on is what's going to happen with healthcare reform and how is that going to affect especially the public health in our community and what we do. Second question is why did we spend the money before the TIF bonds were released that we spent so far? Third was the design philosophy of our proposed building. And the fourth was the relationship that we have to the NCRC at this point. What are we doing with the research campus and those activities? So I'm going to talk about those, but I'm going to start out by talking about the Healthcare Reform Act. I'm going to talk in general terms about the act itself, and then Dr. Suda is going to talk about how that affects our clinics. He is an OBGYN, and he's the one who delivers most of those 25% of the babies we deliver in the county. So you're looking at the man responsible for most of a quarter of the deliveries in the county right now. So, but he knows more about the clinical services than certainly that I do. The Patient Protection Affordability Act is the the so-called Health Reform Act. That's the proper name. This is actually slides I've taken from NACO, your National Association of County Commissioners. So if you go to the next slide, please. The key thing to know about it in terms of the Medicaid and safety net is that Medicaid coverage right now is about 200% of the federal poverty level. This will move it to 133%, which means a lot more people are going to be on Medicaid than are now. The chairman had sent me a Huffington Post article which very much tracks along the things I'm reading. There's a lot of people that are now going to be eligible for care that previously were not, that have insurance of some kind, whether it be Medicaid or whether it be national health insurance. Those folks are not going to be able to be seen in the traditional healthcare system simply because in Cabarrus County and everywhere else, we don't have enough primary care doctors. So those folks are going to be flooding ER rooms, flooding public health departments. So we're going to see a large increase probably in the patients we're seeing. So that was the key point I wanted to relate to you from that. There's also some information there about slides and the slide about cuts and other things, but those are not as critical. If you go to the next slide, please. The key thing in the Affordability Act that you need to remember about the Public Health Department is Title IV, which is to do with the prevention of chronic disease and improving public health. Next slide, please. And that is the Prevention and Public Health Fund. So there's a substantial amount of money in this act for public health. It's to provide for expanded and sustained national investment in prevention and public health programs to improve health and help restrain the rate of growth in private and public sector healthcare cost. Next slide, please. And this is the amount of money that's in there for public health. Starting in 2010, $250 million, all the way to 2015. Each year there'll be $2 billion in for public health. So this is the first influx of money for public health. I've been at this now 29 years on July 13th, and we haven't gotten any new money from the federal government over that period of time. So this is a huge difference that we've seen in public health. So there'll be a lot of money coming down the pipe and in terms of what's being funded for public health. Next slide, please. This is just an announcement that was just a couple of weeks ago that Secretary Sebelius released. The first $250 million has now been announced. Hasn't been determined where that's going. If you multiply that out, that's not a lot of money over 50 states. It's about $5 million per state, but it is significant and it's starting to flow, so this money will be soon coming down to the different states and to the locals. So we'll have, I'm sure, grant opportunities and other ways to go about this money. So this is kind of an overview of the Health Reform Act itself. If you go to the next slide, Dr. Suda is going to talk about our clinical services.
Before you get to that, I don't want to interrupt, but so when you're talking about the new money that's coming, or this money that's going to be coming in, we don't know if it's coming to the Health Alliance or if it's going to fund the insurance. Or do we know where that money is potentially going? Or is it just going to be available that grants are going to be requested off of it?
We just know it's dedicated to public health. It may go to the states. The states can then decide how it's allocated. It may be in grant opportunities directly with the federal government from the locals. It just hasn't been determined yet at this point. Okay.
And Dr. Pilkington was referencing, and I've got the article here, if anybody wants to look at it, about from the Huffington, I believe it is, Post, but it was basically what it was talking about. It was tracking Massachusetts is the first state to have expanded health care, and that more ER visits are occurring in there because of the Medicaid recipients, and then the Medicaid recipients are going to more emergency rooms, and that's having a problem because there's not as much of family physicians to see them instead of emergency room. And then the family physicians that are seen are cutting back on Medicaid because of the reimbursement, I believe, is lower than what they can, I guess, what they can do, cost to do business. But I've got the article if anybody's interested, or I can email it to if anybody is interested, just to let you know. Sorry to interrupt.
Okay.
Thank you. Can you try the next slide there? Great. What I'm going to be talking about is the magnitude and the scope of services offered at the Cabarus Health Alliance clinically, and the trends over the past few years, and the patterns that affect the movement of patients to and from the Cabarus Health Alliance and to other organizations in our community, and finally the effect of the National Healthcare Reform Act, or the PPACA. If you look at what I have up there on the insurance status, one of the main drivers for where patients go for care in this community for obstetrical care is whether they're insured or not. If they're uninsured, they pretty much all come to us because they're asked for money up front to go to a private practicing OB service, and they don't have it for the most part. Medicaid patients do have a choice. They can go around, and we get about 40% of all the Medicaid patients out in the community. In general, private practice obstetrical groups will take Medicaid patients if they have not hit their ceiling for the month. In real good economic times, that's the next point I'm trying to make there, is in real good economic times, their payer mix is going to be better if they accept Blue Cross Blue Shield patients as opposed to Medicaid because they're ceilinged out. So we'll get some of those back to us in better economic times. Right now, because of the economic downturn, we pretty much know that any Medicaid patient leaving our practice and going to a private practice is going to be able to get it and get services there.
Can you explain what ceiling out means?
Well, if a practice is going to deliver 30 babies a month and they can't take on any more than that, then as soon as they hit a panel of 30 for the given month, they will stop adding patients that are due in that month. In economic times where the natality rate, if you look up there under economic climate, the birth rate goes down, it follows the economy. Right now, there's less people trying to get into OB practices because there's less people pregnant. We've seen those numbers drop at the hospital, and therefore they can move around and find access where they have to find access. The next point is no significant increase from unemployed at CHA. We thought we might get a windfall of obstetrical patients from the unemployed losing their coverage. That hasn't happened. It's probably because they're just not having babies right now. They're taking care. The Federal Qualified Community Health Clinic does not provide OB services and does not have any intent, meaning that the indigent in this community are going to have to come here for their OB care if they're not getting it at a private service. The physical building is a problem. We have patients leaving to go into private practice when they get their Medicaid card because they like the better environs of a private practice office. Our place is large. It's an old, it's a previous Kmart building that's been partitioned up. It's large, it's impersonal, and we see patients leaving our practice when they get that Medicaid card. For the most part, they have loyalty to the previous OB doctor. If they've gone to a private practitioner, they like to go back to that same caregiver again. What we really have and what we really offer to our patients is all these adjunctive services, including a licensed clinical social worker on site, nutritionist. We have WIC services on site, our own lab. Our pediatrics is done there so they can come and get both services under the same roof. We have outreach that starts from our organization, ultrasound and high-risk coordination activities for patients with high-risk obstetrical problems. Transportation is a well-known problem for access to care, and so if they can come to one place and get everything done, it's really good for them. And I think that's what really brings a lot of the patients to our care. Can you try the next slide? This is just a distribution of those patients who have Medicaid and other forms of coverage in our service. As you see on the right, there's almost 40% of our patients are self-pay, and they're committed to us. They really can't get their services elsewhere. The other 60% can go to the other private practices, especially in economic downtimes like now. But we capture about 40% of that Medicaid population for delivery. Next. If you look at the ethnic distribution of our patients and racial distributions, the white Hispanic and the black Hispanic constitutes about 56% of our patient population. We capture most of those because it's pretty much synonymous that if you're Hispanic, you're not going to have a Social Security number in our population. And without a Social Security number, you're not going to get Medicaid. So they end up coming to us, and we deliver 2 out of every 3 babies is Hispanic. Next slide. This is something that I failed to put in that first slide, and I added it later. Family planning. We do birth control at the Cabarus Health Alliance. We see about over 5,000 patients there. And it's an important site for birth control, Pap screening, and STD screening as well. It's guaranteed confidential provider of family practice services. And national health care reform is really not going to do much to send those patients away from the Cabarus Health Alliance or public health and 2 other forms of service delivery. It's pretty much going to be neutral because whether you do it under an amendment or under a waiver in the state, the implications are not great. And we would expect to have an ongoing family planning care service of 5,100 patients or so in the future. Next slide. For pediatric patients, we see, as I said before, about 8,100 visits a year, and that's been relatively stable over the past 3 years. Insurance status is a much less of an issue. You'll see in the next slide that those are patients are primarily all have Medicaid or some form of insurance. Hispanic patients who give birth here have American citizens as children, of course, and they're indemnified from the outset. So the movement of patients isn't driven so much by insurance status as it is by where they really want to access services. Same thing in terms of the economic climate. If we're in good economic times, they may actually limit the number of medications getting into the pediatric practice, but in down economic times, they pretty much take anybody that's got a Medicaid card that comes to them. Again, uninsured have to pay up front, but you'll see there's not many self-pay when it comes to pediatric patients. If you look at our federally qualified community health center in Cabarrus County, which is the McGill Clinic and Logan Clinic, they're open to pediatric patients, and they're seeing pediatric patients. So we do have another access site for pediatric patients in the indigent population here in Cabarrus County. Physical building, same thing. People like the private offices more, of course. Physician coverage, not felt to be as large a factor because you can get consistent care by the same pediatrician at the various offices, and you don't have to transfer that care over into the acute care setting of the hospital to get your baby delivered. That's more of an issue in obstetrics, where they want to get the same doc time and time again and ultimately to deliver their baby in the hospital if it's at all possible. What really drives, I think, our patients to see us in Cabarrus Health Alliance is the adjunctive services. They really like the fact that they have access to nutrition, and WIC is a real big attractor. WIC sees about I'd say about 18,000 patients a year, and so it is a big reason that people come for pediatric care to the Cabarrus Health Alliance. Again, transportation is a well-known barrier to access. If they come to us and get all these services under one roof, it's more likely they're going to be compliant and get those services. Next slide. This is just a portion, once again, a distribution of our payment sources of our pediatric patients. You can see in the second to the right column, there's zero self-pay and all kinds of little hybrids of Medicaid and self-pay, Medicaid and other kinds of insurance, and private insurance. Medicaid covers basically with Medicaid and self-pay about 80% of our patients. So again, insurance isn't the big driver in terms of where patients go to get their care. Next slide. And the racial and ethnic breakdown, very heavily Hispanic, even more so than our obstetric population. But again, Hispanics in this situation do have access to get Medicaid. So again, Medicaid isn't the ultimate driver in terms of where they go to get their care. Next slide. We almost got it here. The effects of national health care reform. This is very much an overview. It's not meant to be detailed. I've taken key points from the Patient Protection and Affordable Care Act and applied them here to draw some conclusions over the next 3 slides. And the first point I want to point out here is that changes in public coverage under Medicaid, there really is no significant change coming from the Healthcare Reform Act. Pregnancy has always been highly indemnified, up to 185% of the federal poverty level. It's going to remain so. And for children, coverage basically has been mandated to maintain its stability through 2019. On the right side, you see National North Carolina Health Choice, which is the CHIP form of pediatric coverage, the health insurance for pediatric population. In 2015, there's going to be a 23% expansion by the feds, increasing matching rate for the states to see pediatric patients. Tax credits are going to be coming down to help people get into state insurance exchanges during that time period as well. And there's $40 million in grants that are being doled out for organizations to try to educate people on how to get access to get their children on these indemnified rolls. So we're going to see some expansion in pediatric coverage. Can you have the next slide? So, in conclusion, if we look at pregnancy care in this community, I don't anticipate there's going to be any significant effect on pregnancy care, on obstetrical care, since pregnancy care has traditionally been highly indemnified by Medicaid, and there doesn't seem to be any significant change coming. Illegal immigrants will not get coverage by Medicaid. That's no change. That's the same. So the conclusion I drew is Cabarrus Health Alliance will maintain a robust OB practice as long as there's a high percentage of Hispanics in Cabarrus County and a high number of indigent qualifying for Medicaid. Next slide. In terms of the pediatric population, there's going to be a modest expansion of covered children since national health care reform primarily mandates maintenance of eligibility through 2019. Around 2015, there's going to be more North Carolina Family Choice that's added on top of that. We're going to get more coverage for school-age children. Newborns to 5-year-olds, that's Medicaid. That's going to be solid through 2019 with an expansion for the school-age children coming in the middle of this upcoming decade. So the conclusion I drew from that is, assuming there's no significant expansion in the number of pediatricians in our community that are going to want to compete for these patients that we're getting, and because so many of these patients, I believe, are coming to us because of the adjunctive services that are available at one site, one location, I don't think that we're going to have a significant change in our pediatric patient volume over the next 10 years. I'm certainly available for any questions on that. Thank you.
Anybody have any questions? Got a couple for you. McGill and Logan, you mentioned those as facilities. Are the doctors or the medical doctors there provided by the Health Alliance, or they're on their own?
They're on their own. They're under a federal
Okay.
grant, and they're separate.
Except you.
And,
Oh, except-
Yeah.
sir?
Dr. Suda works there.
Okay.
So.
But in regards to the Health Alliance, they're just, I guess they're assisting in this, y'all not being so crowded, so busy. Is that what the reference was, is the reference?
Yes, the reason the Community Health Center began was because of public health's inability to serve adults. There are no sources of reimbursement for adult primary care, and we tried it a couple of times, and both times we lost in the neighborhood of $300,000 a year each year. So the adult primary care can be served through the community health centers because they get a large subsidy from the federal government, being federally qualified health centers, and that subsidy allows them to do that care at no reimbursement.
Okay. And how does the Health Alliance assisting in pregnancy care help the county as a whole? I mean, it does not seem like that is a mandate of Health Alliance, but y'all have taken it on. And what's the purpose? Why does it help? Why do we do it?
We deliver, 3 years ago, we delivered 578 patients. That dropped to 478 in the 2008-2009 year. In this past year, we've delivered 450. So we've dropped down with the natality rate dropping economically. But if we wouldn't deliver those patients, the Medicaid patients would have access to private care, but that 40% that's uninsured would be basically on the streets. They would be coming into the ER, they'd be coming into triage and labor and delivery fully, at term, with all kinds of problems that they bring with them. That's a significant population of patients that has a lot of pathology associated with, typically indigent populations with poor nutrition, a lot of abuse of different types of substances, nicotine, alcohol, et cetera, run a high proportion of high-risk obstetrical issues, and you don't want that population out there not getting care. You could test the waters and see what happened if you stopped doing OB care, but I don't think that anybody would convince the status as it is right now with picking up 40%. So that's, in our population, that would be about 200 deliveries or so a year without getting any significant reimbursement on those patients.
And Mr. Chairman, another point to remember too is that North Carolina ranks 43rd in the nation in infant mortality, and has always been, in my almost 30 years, in the lowest 10. We've never very much improved. Cabarus has always exceeded those measures by far. We've always had a reputation and an ability to succeed in keeping that infant mortality rate down, and part of that's because of these kinds of programs.
Okay. There's also a reference throughout the slides about an FPL. What is FPL?
Federal poverty level. I'm
Federal.
sorry.
Yeah.
That's all the questions I have. Anybody? Okay.
Okay, if we could move to the next set of slides on the timeline. I can't hardly see those from here. Thank you. The reason I put these together is, as I said, some of you have had questions about why did we spend the amount of money we spent without an actual TIF in place. So this is an attempt to try to answer that from our perspective. We found out about the TIF in the, back to a different slide. Found about the TIF in the summer of 2007, and you can see the language there that the Cabarus Health Alliance, as determined by the county, was to be a primary part of that TIF. We started working on it immediately after we found out that we were going to be part of it. We tried at first to locate exactly on the research campus and worked with Mr. Murdoch on trying to do that. The cost of land and the cost of the building sites there was much too high for us, even within that budget. Those were good economic times, and $15 million would not have built anywhere close to the building we're talking about now. So in consultation with the county manager, we decided to move off the research campus side but stay as close as possible. And that decision was made to locate on the Loop Road site, which is where the Sherwin-Williams property is now. Next slide, please. That was in January. We started moving on down the road pretty quickly. Some communications here from the Kannapolis city manager. That's what KCM represents. CM is the county manager, saying that the TIF bonds would be available on about May 21st, which certainly panicked me. We were nowhere close to having a building or anything ready at that point in time. And how the actual money would start flowing is in those emails. In May, there was the idea that we would be shooting to be ready by the end of July, early August at the earliest, or at the latest. So given that, we signed an agreement with Odell Architects to develop a design for a building, as there was no way to budget or determine what we needed without any of those things. So we went ahead forward with the actual contract for architectural design, still fully believing at that point in time that we were looking at the summer of 2008 as our fall, at least, of starting groundbreaking on a building. Then we got a communication in early winter of 2009 that the funds would not be available at least until the summer of 2009. Next slide, please. All that's based on is, I put an asterisk down here at the bottom, that as you all know, and every one of us know, the economy collapsed during that late summer, early fall period of time. So all bets were off as to what happened at that point in time. We went ahead with our initial construction bids and selected Rogers Builders at a building cost of $8.3 million at that point in time. That was about $3 million less than was initially estimated to build that building that we thought we would need. We also selected Alfred Williams as our office furniture contractors, and all those bids were locked through, and office furniture and other ones related to that till December of 2010. Then we had some communication from the county manager regarding our to and from the county manager regarding our costs, which at that time had exceeded $500,000, and the possibility of the county loaning us some money because that was a really tight beginning of our first tight budget year, and the issues that were associated with the fact that it didn't look like the TIF bonds were going to be sold anytime soon, and we were out the over $500,000 that would come out of our operating budget. And that there was probably going to be at least a year or more before there would be any significant changes in the market. Next slide, please. Last June, a year ago, Mr. Phillips, myself, Mr. Day, and Mr. White met and talked about this whole idea of where our building was, and there was a communication afterwards to you as the board about which way we should go in terms of a bank-qualified loan, and the issues that it was posing for the county in terms of debt. And at that point in time, we still felt like we were headed in that direction toward a building. Next slide, please. Then in July, there was a communication from the county manager to the Kannapolis city manager that the board was willing to dedicate most of all of its current incremental revenues from the TIF district to finance the CHA building, whatever else can be serviced by the current incremental revenue. But the board is unwilling to issue the debt and has no objections to the city owning the CHA building for purposes of collateralization. So again, still in July of last year, we felt like we were still moving toward. Continue, please. Next slide. We bid the building again for a second time because our first bids had expired. This time our bid came in about $700,000 lower at $7.6 million. In addition, the Cannon Foundation awarded us $200,000 for a dental facility in the new building. And in January, we got our price bid guaranteed through April 1st. February, we got the first notice that the county might not support Cabarus Health Alliance in the TIF, and that was a communication between Mr. Day and Mr. Legg. And at our budget meeting, Mr. Day informed me that the county likely would not support the CHA being in the TIF at this point in April. May, we went ahead and got another extension, I guess still ever hopeful that something might happen, with a $45,000 increase in the price that Cox Shepard guaranteed, and that price was locked through June 30th. They've now extended it through July 15th. I doubt it'll be extended beyond that. The steel market has started moving, and because of that, that's a good part of the cost. So with the steel market moving, we'll probably have to go to rebid at some point soon, if we go to rebid, and see where that goes from there. Next slide, please. This is what we've spent on the building so far. Architectural fees of $359,870. With our first contractor, Rogers, we had a fee built into that by taking the bid, and that was $28,556. Our land acquisition, which we acquired in the summer of 2008, those were 2 tracts of land that were available adjacent to the larger tract of land, and those were acquired, as I said, in the summer of 2008 for $239,000. Property maintenance so far, we have to keep up the property that we acquired, as well as advertising the bids for the different things we've bid on, of $525, and those things total $628,907. And the condition on the Cannon grant that it goes to the building that would build would also be lost. It'd be a $200,000 investment in addition in the building that would be lost to the $628,000. So that's kind of why we spent the money we did and where we are. So is there any questions about how we got to that point?
Any questions? Nope.
Okay, next. What we did in terms of a design on the building, and I think it's important to understand, we took this as a chance to do something that would be really impressive on a research campus. So what we did was we convened a national panel at the UNC School of Public Health to help us design the model health department. This was the document that came out of it, which you see up there. And I'll be glad to share it with anyone. It's online on our website, or I can also email you a copy of it. But the goal was to develop something that had not been seen before, a health department that truly was a model for the rest of the nation to come and look at. Most health departments in North Carolina and throughout the United States have a saying, if you've seen one health department, you've seen one health department, because they all look alike. They're institutional grade. They're the worst buildings, the worst sites. And we wanted to do something different, something that would really be a credit to the community. And we were able to do it, fortunately, because the building costs were going down. And since the building costs were going down so drastically, that made us able to start doing some design that would really be something to be impressed by when you looked at it. Next slide, please. And these were the design principles. As I said, a model health department. We wanted a image that has a distinctive presence in the community. As Dr. Suda said earlier, we actually do have patients who come into our building and leave and will not come back, primarily because there's a sheriff's building at the very entrance to it, and they're intimidated by that. And it makes an imposing entrance to a building when the first thing you see is an enclosed sheriff's entrance with 2-way mirrors in it. So that doesn't do well with a lot of the public coming to see us for services. Provide a flexible and creative environment. We wanted it to be an environment that could change. One of the things we found in looking at other health departments and talking to people who've built other ones is they built them so they couldn't change and be different. We wanted one where all the furniture on the walls came off and could hang, where all the rooms could be either exam rooms or offices, so they'd be plumbed up front. So if we needed more exam rooms for Dr. Suda and his clinics, we just opened the wall up and we had plumbing. And if we needed it to use it as an office, we just closed the wall and it became an office. So we wanted it to be a very flexible and moving environment. The entire 3rd floor of this building is totally open. There are no offices in the building at all. No one has a private office, including myself. Every office is it's an open office concept. So the idea was to make it a very open complex. We wanted to create patient staff areas that had light. One of the things, of course, being in an OK Mart is you have no light. So we wanted natural light in every place that we could get it in the building. So almost at any point you are in this design building, there is natural light flowing to you at any time, any location. Next slide, please. You heard me say earlier we had moved on to the Loop Road. If you see the blue dot, that's where we're located now. The arrows are drawn to where the core lab is, so you get kind of an impression of where it is. The nice thing about the building that I liked about the building site is it overlooks the whole research campus. So we're up above everyone else. That's kind of nice looking at the research campus. Next slide, please. This is the actual layout as we have it. If you look to the right of this slide, that's the loop road, and across it is the research campus. Mooresville Road is running along this underside of it. The front of the building actually faces backwards. But we designed it so that the side facing the research campus looks like a front. But we actually designed it that way so we could take advantage of the parking and get people in and out. It's really important for our patients, again, not to be intimidated, not to be turned away, because a lot of them are. So we've got a little curb up there on the top for the bus to pull in, and we can drop the patients off who need to ride public transit. The parking is going to be right there with a little canopy so they can just be dropped off, and the bad weather and such. So it was important to get a front so that it could be close to a parking lot. Next slide, please. There's no way I can see that one, so had to be like 900%. This is actually the space allocations. The building's about 58,000 square feet. We did an exhaustive programmatic analysis of how much space we need. We're right at about 33,000 square feet right now, and we literally have this week folks coming from the National Accreditation Board. We're one of 30 sites in the nation picked for national accreditation, and we've been trying to figure out where to put things because there's so much stuff in our aisles and boxes in the way. But we really wanted to get it down to a building that we could use, that we wouldn't move into like we did in Kannapolis. It was already too small by the time we moved into it. So that's the allocations out per different area. Such things as dental are on there and so on, health initiatives, immunizations, international travel, all those things are listed and broken down by exactly the space that they'll need in the building. Next slide, please. This is the schematic of the first floor of the building, and this isn't the idea. And again, the design was a lot of buildings that I've been in, I'm sure you've been in too. You walk in and you try to figure out where you're going to go, how you're going to get to the service. The goal of this building was that you never have to have much signage to find where you're going. So, for example, if you see the top entry when you walk in, it's angled on the back. The elevators stick out so you can see the elevators. You can see the back conference areas where the public meetings will go on. So, for example, we're having an H1N1 flu clinic. That'll be in all those back rooms at the bottom, and you'll be able to see them from there. You'll be able to see international travel as soon as you're walking on the right. You'll be able to see the dental clinic on the left. WIC, which, as Dr. Suda pointed out, is a huge operation. You can see a lot of the first floor is taken up by WIC. It's right there as you walk in. So it's laid out in the fashion so that people will easily be able to wayfind as they come in the doors. Next. Second floor is our clinic area. One of the things we've kind of pioneered in this, and this is something you don't see very often in clinical settings, is that top all the way around and on each side is clinic rooms. What you generally find is that clinic rooms are broken off to pediatric, to maternity, on and on. What we've done is break off the entrance areas to those. So when you come off that elevator on the second floor, you can easily figure out if you're a pediatric patient, you essentially go in the same area. But then in the exam rooms on the back side, we can divide them up. So for example, if Dr. Suda is having a huge maternity clinic day, we just take 40% of the rooms for him and 60% for the rest. If he's having a real big day and he needs 80%, we can just give him all the rooms. And right now we don't have that capability, and most health departments don't. Most clinical operations don't. It's really set up in a very compact area that you can't do much with. And those are all flowing around the outside of the building. Again, all the waiting areas have access to light. But this whole second floor is nothing but clinical services. When you come off the second floor, there's a public education area that will be there for the public to come to and get information, as well as our patients, on different aspects of healthcare. We have nothing like that now, so that the general public can come in. If they walk in and say they need information on STDs, for example, and they need information on ticks, we have to take them, walk them all through the building, go find the brochures. This will be an area where everything will be right there on a computer. You can just pop it on and look at all the subjects you want to related to public health. So that'll be a nice addition. The third floor, next slide. Third floor is where most of the offices are. You notice we put a really small area for medical records. If this building ever does become a possibility, we're in the middle of doing electronic medical records. We just started. And so we hope to not do what a lot of other folks have done and get a building built and not have electronic medical records, because that's a disaster. You need a lot of space for records if you don't have them on an electronic disk. So we will have that small space for medical records you see up there. The rest of it is our general office space, and as I said, you see it's all open. Everybody will have a workstation of some kind, and that's the way. And that's one of the reasons why we said we locked in our office furniture vendors, because we wanted to make sure we had those prices locked in, since we were going to a much different way of doing things. Nice thing about that third floor, too, being totally open, is that it also lends itself to different uses. So, for example, if the public health department did shrink drastically from healthcare reform, there's a third floor somebody else could use. We would just go down the floors. So it'd be usable just about for anything else. Next slide, please. This is what the actual front of the building, the one that's to the back side of the parking lot, looks like. You can see the canopy, a lot of glass. Again, it was important to us to get the natural lighting in. It's also important to have a canopy, because we have a lot of pregnant women coming in who need a shelter to be dropped off at and not be dropped off out in the rain. So it was, that was a key thing for us. It's not an expensive canopy. Actually, it's a very low-priced canopy, but it was important to get some kind of canopy in front of our building. Next. This is, again, a close-up of what the canopy looks like. Next slide, please. This is the side that faces the research campus, so you can see it looks like the front of a building, and it's actually even got a sidewalk leading to it like it is the front, but it's no entrance there. That side is meant to be, the brick and everything is meant to complement the research campus, so it looks like it fits in. This is a little bit different than the research campus architecture, as you noticed, but the goal is to use the same color brick, the same style on that side to make it look like it fits in and looks good from the research campus side. And that's actually looking from the research campus what they would see if they looked at the building. Next slide, please. This is a further look from the research campus, what would be seen. This is actually looking from where the new medical office building would be located across the street on the corner from us. And that's the site that we initially had talked to Mr. Murdoch about. But this is the view it would have of our building. Next slide, please. This is the entranceway. We have a lot of history in Cabarus County that's important from a health perspective. If you look to the left, you'll see a history wall. That's one of the things that was important to us to put in this building. Not anything expensive, but something that we don't lose the sense of what we are in Cabarus County. In 1955, we were the first community in the entire United States to vaccinate its population against polio. And if you go back to those papers, you'll see a young Fletcher Hartzell being vaccinated on Union Street in the paper that day. He didn't look too pleased, but he was he was getting his polio shot. And we have a plaque in our building right now commemorating that, but we want to get all those kinds of things that we have that are first in Cabarus County up on a wall in a place where they are significant and important and people can remember them and understand what we are and what we've meant to the community in terms of health care. We celebrate our 100th year next year. We're one of the oldest health departments in the entire United States. And it's going to be a significant year, we hope, in our history. And all throughout those 100 years, I could go through the list. You don't want to hear them all, but we've got so many firsts, it's incredible, of things we've done. First, we were one of the first 6 health departments in North Carolina accredited. We're now one of the first 12 in the nation will be nationally accredited. So we're one of the always leaders. And that's, again, people ask me how, and I always point back to the county commissioners, and I say that sincerely. From the very beginning, we've had strong support from the local government, and that's not true in other counties. It just isn't true. It's unfortunate, but that's the way it is, and that's the way it is nationwide. I just visited Mahoning County, Ohio, to do their site visit for accreditation recently, and the difference between the funding they put into public health and what you put in from Ohio is ranked 50th of 50 states in what it puts in local government funding for public health. So that's just to give you an impression. To go into a department like that was like, wow, don't ever think I want to go to Ohio. So that was, but if you look, this is the walk in the front door. You see WIC to the right, and you don't have to guess where it is. You see those elevators back behind the 2 people holding hands to the left. So there's really good sight line throughout the building. The stairs, again, because we're public health, are important to us. They're right there. So they're there to climb if you want to be healthy. So that was the key to us. The upstairs is open, again, trying to keep that light coming in. And that front is an atrium so that light naturally flows through it. Next slide, please. This is just the information desk. It'll be there to help guide those who need it. Beyond that, next slide. This is the second floor where you'll be able to walk in and come off that elevator there and see. Again, you can see as you walk off the elevator where you need to go. All the lighting is there. All the windows are there, so it's easily directive to where you need to be. Next slide. This is the clinical area. You can see the windows in there, and it also if you could read those signs over the top there, it'll tell you where you check in for what service you need. So if you're going for pediatric, you go to one window. If you're going for maternity, you go to another window. If you're going for adult health, you go to another window. So you always are able to move out to those clinic areas that I spoke of earlier. Next slide, please. This is the second floor education area, which will be one of the things we're proudest of if it's ever built. This will be an area that the public can come to and gain a lot of health information. That we've seen this in a lot of so-called private clinics. Almost every key hospital, like a Sloan Kettering in New York or a Stanford Medical Center, has an area like this that the public can go to and have the latest access to any health information they may need to see. Next.
If I could just
Sure.
interject. The funding that's being provided in the Health Reform Act for prevention, this would be a key element of that, because getting people good information so they can make good decisions, and particularly if it's formatted correctly, so it will change behaviors. That is, I think, a key to public health in this century. Last century was all about infectious diseases. This century is going to be all about prevention, and the federal government is starting to put some money into it, and we planned this with the anticipation of prevention, and now there would be some money to actually use it. So I think this would be a key element of the design, because it would be a place for the public to get the information they need in a format that would help them make healthy decisions, because changing behaviors is what it's all about, and this would be a place that would foster that.
The information that people would be asking, is that in one, I call it portal, it's probably the wrong word, but internet access site that people would be able to gain that information?
Yes, to link to certain healthcare sites like the Mayo Clinic or
Can you,
WebMed.
is that information accessible wherever you have a computer? I mean, you wouldn't be just at the Health Alliance, you could be at home.
You could be at home as well, and one of the
Okay.
things that this would be directed. For example, one of the things we're working toward right now, we know that when a person leaves any physicians, and you know this yourselves, when you walk out of the physician's office, how much do you retain of what you were just told? And the estimates are between 20 and 30%. So what we want people to be able to do is, knowing they're going to come out of the room without knowing anything, be able to print something out in the room that gives them a link to some, for example, if they have breast cancer, here's a link to a website. You go to our education area, you can mine the education there. When you hit it, it'll be set up to go to those sites automatically for you, instead of having to do the mining you do at home to get to those websites. So that's the kind of, and also for the public, we have unbelievable number of folks who are just walking off the street wanting to know different things about healthcare. And we really don't have there's nothing to do except take them back to, right now we have what we call a literature room full of just different pieces of pamphlets and things. We take them to those and show them what we have there, but we really don't have the ability to develop anything like this at this point in time. I think, is that the last slide? Is there another one? No, that is the last slide. The last thing I just wanted to talk about real quickly that the chairman asked me to talk about was our relationship with the NCRC at this time. Do we need to be on the research campus? Some of you have asked. Not necessarily. I mean, that was not really a decision we made. We were part of the TIF, and the TIF requires us to be on the research campus. But since we've been moving that way, we have had an employee we've designated to work with the research campus. We have a research committee that Mr. Phillips serves on that works with the different universities on the research campus. We've got a couple of projects we've been working on. We're working on a project with Appalachian right now on the Chia Seed Project. Some of you may or may not be familiar with that, but it's what's the impact of ingestion of chia seeds. These are the same things that we are chia pets. And so there's a project going on with that, and we have an intern we're sharing with Appalachian State. They're paying all the cost, but we're getting to share part of the intern, which we like. It's always good when you get free labor. We're also working with Duke University on the Murdoch study, not only as a blood draw site, but in terms of some educational things we do with them as well. So we've got a couple of linkages and see the possibility one of the things about our patients, and this is why that we're attractive to Duke and other folks, is that, as Dr. Suda will tell you, our patients are the sickest. So when you have the sickest patients, then they work best for research purposes. And so we would be able to, they would be able to access our patients more easily if they were on the campus than they would be if they had to transport them across the county in buses or private transportation. So that would be one key reason to be there. But truth of the matter is, we don't have to be on the research campus. We've only worked our programs around being on the research campus because we thought we were going to be there. That's just, in essence, what we've done. So with that, I'll stop and answer any questions.
I just comment too that I sit on the board of the research center for the Murdoch study, and through discussions we had there, Dr. Monique Giroux, who's on the faculty at Duke, is going to be starting a study on preeclampsia with pregnancy. Hopefully in January. It looked like it was going to get funded. It didn't, so it's been delayed by 6 months. But we'll be looking at our patients and our population who are destined to get preeclampsia or potentially get preeclampsia. They'll be completely fingerprinted with, it's hard for me to say this word, metabolomics and proteomics, and looking at all these different molecules, and then seeing in retrospect, if you get the patients who develop preeclampsia and the ones who don't, you go back and you look for a fingerprint metabolically, you know, what maybe there's some sign there that you can use to predict preeclampsia. It's one of the most difficult problems we have in obstetrics in general is that preeclampsia, which is still one of the largest killers of women in pregnancy and babies as well. We don't have a way to predict who's going to get that disease. Duke wants to do a project with our people starting again in January. We're looking to collaborate.
Any questions, or Commissioner Minot?
Just on the flip side, you said you don't necessarily need to be on the campus. Is there a benefit to this location being more centralized in the county?
Well,
I mean, I'm sure you've heard that before. What's the answer? Or is it
the
good or
answer
bad,
is
or-
the answer is that when we were first told we were going to Kannapolis from the old site down on Cabarus Avenue, we didn't have any input into that decision, and we were just told we would be in the Kmart building. So we immediately started looking at what our patient mix was, because we had really never done that before. And at that point in time, in 1977, I think it was, 1997, thinking when I came here. 97, the 80% of our patients came within 5 square miles of I-85, either side of it. So we were good. We were still, and we had bus system coming into existence. Wasn't here yet, but we knew we'd be able to get public transportation. We've recently done those studies, and if you go about 8 miles on each side, we're covering about 80% of our patients, 8 miles on each side of I-85. So going that far is not going to be a stretch for our patients so much. It would be nice to be more centrally located. In fact, if I were going to look for a site and I had the same $15 million, I would certainly want to be more centrally located in the county, because where we were on Cabarrus Avenue was dead center in the county. But without that, if the $15 million has to go to the NCRC, certainly we want to be there. So if that answers your question.
Good question.
Any other questions?
You mentioned land acquisition. Did you purchase all the land that you needed, or is there another parcel of land that you would still have to
There's
purchase?
still a $2 million tract of land that we haven't purchased. That was just.
I didn't think that was all, but I wanted to make sure.
That was
that's-
2.5 house sites at that time.
Any other questions or comments?
And it's, when I first saw the drawings, and I saw when you said this was on the side of the research campus, this is actually on the outside of the loop, not on the inside of the loop.
That's right. The outside
Okay,
loop.
so it's, you know,
It's in the district, but it's,
not to be flippant, but it's what, 2 doors up from Hardee's, so.
Exactly. It's the old Sherwin-Williams site. We tried to find, it's difficult to find land in that area.
Yes.
So this was the only piece of land, and we've actually filed action for eminent domain for the land. We haven't taken it by eminent domain, but we filed action. The major part of the land's owned by Mr. Murdoch, and we filed an eminent domain action against Mr. Murdoch for his property. So
How many total acres of land do you need for this?
we'd like to
That you're
have
planning on?
closer to 4, but this is about 3.25. So Parking will be a little bit tight, but we have some commitment from Mr. Legg that we can extend down. There's an area beyond the street that we can extend our parking if we needed to.
How about bus access?
Bus access will be there. The bus service has told us wherever we move, they'll move with us. So we have enough clientele.
Yeah, another thing about the relatively remote location is a lot of the clients come by bus, and they're gonna have to make a transfer anyway. So, I mean, a lot of them will be on the same route, so they just get off that same route at a different point. So it isn't gonna have a significant impact for them.
Commissioner Privet, you got any questions or comments?
Question I had, Ms. Mott had asked that we're dealing with public health, and it looks like a long way for folks from Midland, Harrisburg, Mount Pleasant have to go in order to get public health.
Okay. Thank you very much. We appreciate it.
Thank you.
Thank you.
There's no action that we need to take at this time. It was just for informational purposes. And there's nothing for us to further discuss right now unless we'd like to discuss anything else. I think it was very important to hear from Dr. Pilkington and everybody about the building and the importance of it there and what we had, what's facing in regards to the federal plan.
I got a couple of questions. I just was curious, and I've asked it, I think, before, but and maybe had to answer before, but I didn't remember it. But what is the overall, with the package, looking at with the Health Alliance and the rest of the infrastructure, is the overall debt service projected, annual debt service projected for that TIF issuance? And I guess that's the first question. Another one is that the base, I believe the base value has already been established for the TIF district, hasn't it? Was it established last year? And then what increase did we see this year in that?
This year being this tax year?
Yeah, this tax year, what increase did we see?
There's
in the
not
first
much of
year?
one for this year because most everything, well, remember we go back to January, so what you saw on the ground in January, which was, you know, the existing buildings that are there now, plus partially completed community college building. And, you know, off the top of my head, I don't have what that value is. The amount of revenue it produces is between the two, about 2.6 million, I believe. It's a little bit more for the county than it is for the city. And the debt service chart, we provided that earlier. It starts off with debt service at 2.6 million, and then I think it goes to something like, Mike Legg is here, the city manager. I think it goes to about 4.2 or 4.3 by the end of the term. 4.3
Okay.
by the end of the term.
Yeah, I'm trying to remember it now. Okay, okay.
Any other questions? Did that answer all the questions you had?
That was good.
Thank you. Next matter we have is the discussion with Midland officials regarding the request for the ETJ. It was tabled from our June meeting for Commissioner Caruth and Commissioner Privet. Commissioner Privet was sick. Commissioner Caruth was on a business meeting. There was a presentation made by Mayor Kitts and Mr. Flo in regards to an ETJ. We received that information, did not have any further discussion since y'all were not present, wanted y'all to be present before any discussion was made. Mayor Kitts and Mr. Flo are here today if y'all want to hear anything from them or hear what they have to say, and we can go from there if you'd like.
The only thing I had, I guess, was that the map, and I don't think we have a map here, do we? Do we have a map of the?
No, we just have the letter. Mr. Flo, Mayor Kitts, would you like to fill us in a little bit?
Thank you all for having us again. Appreciate it. Part of our request is, as you know, with us growing and being our 10 years of incorporation this year, we are looking to request an ETJ from you to help us in our efforts to grow at some point,
Absolutely.
and also look to making our town more of a place people want to come and have industry, and keep our tax dollars within Cabarrus County, and look to figure out how can we grow just a little bit more appropriately. We finished updating our land use plan, and we also had some maps that we brought with us last time that Mr. Flo can answer any questions as it relates to the map. And I think we have a couple of answers. I think, Ms. Monette, you had an answer around the open space area that was included. So, Mr. Flo, do you have a few things you would like to discuss?
Certainly. Thank you, Mayor. Mr. Chairman, members of the board, it's a pleasure to be before you today. Just passed along a file to be loaded up here, and we'll be able to walk you back through this. I'd like to start with the sort of a quick refresher of the location of Midland and the county and the ETJ area that we talked about. And in the letter from the mayor, there were some facts associated with that attached. And one of the things that was most significant in our study of the Midland area is what we call a shared jurisdictional boundary. And we're going to have a little bit of information up there about that, but we have more detail this time for the commissioners that saw us before, a little bit more detail. Let's see if we can get this up. We looked at everything from zip codes to school areas and everything else, and our request would keep everything identified with Midland. And it would not affect schools, you know, because it's kind of confusing sometimes when people feel that they're have an address for one place, but they're in the jurisdiction of another. I know Concord and Kannapolis have that experience along I-85 in several places, for example. Harrisburg and Concord have that experience in several places. So we've tried to avoid all of those things. We also have kept it to a little less than a mile at most in places, which is that initial criteria for extraterritorial jurisdiction. Let's see here. This should do the trick. There we go. Thank you, Chairman White, for being our IT today. This is just our cover page. The next slide. The two shades of green in that particular slide illustrate the current town limits, which are the lighter green that meanders. The brighter green is the area that we are proposing for consideration, for your consideration, for a grant of the authority for the town to exercise extraterritorial jurisdiction. Of course, within those areas, you would appoint the board members and commission members to sit on planning and zoning, board of adjustment, things of that nature. But that area kind of shows you what we have there. And you can tell from the configuration for the commissioners that didn't have an opportunity to study this very much. So we have a very lengthy external boundary right now, and I'm going to give you some numbers in just a moment as I reach the answer to Commissioner Minett's question. So if we can have the next slide, at the top of the chart, you'll see that the current land area is about 9.38 square miles inside the primary corporate limits, which means that does not include any satellite. The boundary distance around that is almost 55 miles. To walk the city limits line is 55 miles. With ETJ, the combined land area of the current town limits plus the extraterritorial jurisdiction would be a little over 28 miles, almost 29 miles, but the boundary distance around the entire area would be just under 29 miles. moving on down that chart, the unincorporated, the land area that's unincorporated, that would be the area added to the jurisdiction of the town if our request as it's drawn today were acceptable, is 18.9 miles. Out of that, a little over a square mile is developed to an urban density or urban pattern, and that includes residential and non-residential areas. Now, we used the criteria that you would use for defining urbanization in the general statutes, which means a house on a farm is not considered developed. It's still considered undeveloped. Only a house on a small parcel would be, less than 5 acres would be considered developed. The next item is environmental challenges. Those 3.8 square miles, which is quite a bit, that's about 2,500 acres. Those are areas with steep slopes, floodplains, around the rivers, around a lot of streams and things of that nature by themselves. Those areas that present right away restrictions to or obstacles to any type of development. So we know we at least have that much area that will more than likely, through the extraction of our land development ordinances, be set aside for permanent open space, even under our current policies, if we were to use our current policies today inside that ETJ. I can't speak for your policy, but I would say that you probably have similar policies that would restrict development in steep slope, floodplain, environmentally sensitive areas, so that really would be about the same. Now, what that leaves is, I struggled with the term for this, but I'm going to call it suitable land, and that could be suitable for a lot of different things. Suitable land at about 13.7 square miles. In the suitable land category, if we continue with the policies in place today, could we have the next slide, please? If we can, that's our existing land use. You can see a lot of that green area is part of that 13.7 plus some of that environmental area. So let's move to the next slide. This is a compilation. Really, it's taking all of a large series of exhibits from our land use plan recently completed by the State Department of Commerce Division of Community Assistance. And what they projected was, under our current policies, along with a lot of citizen input, what would development patterns do? And you see a bunch of dots and it looks like a mess. Well, that is basically the patterns of development that would continue to emerge. And what we found in there, and of course they looked in our town limits, but they also saw and noticed and paid attention to surrounding areas. What it points to is that our suitable land and our development patterns under current policy are merging. They are merging. We are looking at ways we have to support that in the future. So we're going to experience development in that part of the county regardless of what happens, whether it's under county jurisdiction or municipal jurisdiction, or at least pressures for development. What we would like to request of the board would be the ability for us to, at the town level, the municipal level, to manage that development pattern, taking into account planning policies, land development regulations, the carrying capacities of our highway and other types of infrastructure, water, sewer, things of that nature, and working with the service providers, which include the City of Concord, which is our sewer service provider at this time, and water service provider at this time, to be able to manage the growth in that area in such a way that we're not running into a lot of what I'll call shared jurisdictional boundary issues. Because remember from that chart that I had with the numbers, where we have 55 miles of shared boundary. That's how many miles of boundary of county and municipal that we will be working on as years go by with different types of projects and processes, whether they're zoning or rezonings or land development issues or what have you. Some of the projects will occur outside the town limits, and the town will be trying to consolidate, or the county will be trying to reconcile how we deal with differences in buffer requirements or differences in serving those areas from police or fire or water or sewer, garbage collection, street lighting, those things that will emerge in a rapidly urbanizing or changing pattern along these corridors. And when I say rapidly, I'm referring to probably the next 25 years. When we look back in 25 years, it will be a considerably different place. So that really is my nutshell. I'd like to defer back to the mayor now to help me out.
And As you can see, there's a lot of potential growth and development that would put a strain on all of us, that could happen, touching the county lines, touching our lines. And part of what we would like to do is be able to work with you to make sure that we can as Mr. Flo said, have cohesive planning services, make sure that we have everything kind of developing the right way and moving down the right path. And that's the biggest thing, because we don't want something to be put in next door that may not be in the future direction of where we'd like the entire community to go. And I'm sure you wouldn't want us to put something in that may not be in the future direction of what you want to see. So we really would like for the county to work with us and move towards this ETJ if at all possible.
If I could add a couple of things.
Sure.
Part of this is going to take us back in our land use planning process. We looked across the jurisdictional boundary. We had to look at the community. So the land use plan done by the Division of Community Assistance really looked at the community of Midland. It didn't really matter because it was non-regulatory, you know, the planning exercise to get public involvement. So there were a lot of people that participated that were residents and property owners, citizens of the areas lying outside the jurisdiction, because we didn't want to limit that.
Right.
We wanted input from the community as a whole. And we do realize that going forward, we will want to look at economic development. We'll want to continue to revisit our land use planning policies and things of that nature to address jobs, to address services, to address many things. And right now, we're somewhat challenged because of that long perimeter.
Right.
If we could look back at that chart again, Mr. Chairman, it was this, I believe, the third page. There we go. You'll see in the top again about 10 square miles compared to about 55 miles of boundary.
Right.
And if you look at the combined land area, that would be incorporated and unincorporated, with a boundary distance of about 28, it's a much greater balance.
Right.
So most of the development in the area would be coordinated through one office rather than multiple jurisdiction offices, and that was something I wanted to point back out.
Right, and one of the key things when we did our land use plan update, we spent 2 years doing it. We had multiple group meetings, and we had lots of people come from different areas, part of the unincorporated area and part of them that in our incorporated town limits, because everybody was concerned about what's going to happen. We don't want something to move in on us. We don't want something that would bring down the value of our property. What's going to happen in these directions? And then part of that is we took all of their input, and that was the key, that we wanted to make sure we took everyone's input and we turned nobody away. And I think we came out with a very good plan. I think David Pugh, our town administrator, brought back up our land use plan for all of you so you could see that, and also our presentation that we had the last time, and also the backup maps that we had. So I hope that was able to help you understand why we're wanting to move this way and how important it is to all of us, because if you look at the southern part of Cabarus County, that is one of the biggest areas for potential growth in the next 20 years. And we are taking it very seriously as a town. We've created our own economic development group, working with John Cox and others to make sure we're looking at how to market our town, how to market the industrial areas, trying to make sure that we're getting out there and we're trying to do things the right way. So that's part of our goals and our objectives, is to come to you and request this.
Are there any questions? Commissioner Kruth?
Well, that's probably a week before the last meeting when you came forward. We're still with the phone, so we have
Yes, sir.
discussed this a little bit. But my question, I guess, is that in looking at the area that's asked, that's the first time I'd seen the map, is that pretty much that's the entire municipal service area for Midland. Mm-hmm. So we're looking at that whole section, you know, of the county. So we're looking at the county's really in six areas, and that's the entire area that we're looking at for ETJ.
No, not really.
It's not, it's smaller than that. If you look at the map, one of the things you'll notice is that a large portion of the part of the ETJ actually fills in between, there was the map now, you can see, I don't have a laser pointer handy, but there's an area, for example, in the northern part of town where the city limits go almost all the way around a large unincorporated area.
Mhm.
And you'll see pockets like that all around the town. So many of those, much of that acreage or square mileage is actually pocketed, if you will, up into and is surrounded by Midlands incorporated areas. And what will happen over the next quarter century or so is those areas will emerge. Many of them will. There'll be pressure to develop. There'll be opportunities to develop. And right now we're at a nice lull in, when you say nice, I don't mean that economically, I mean that in terms of the pace of development. But this lull in the economy is also giving jurisdictions an opportunity to look back at mistakes, go forward and try to avoid mistakes. And we in Midland have learned a lot about what we've done and what we should be doing. And those pockets are the biggest areas of our concern. Also some areas where we follow roads where maybe right across the street it's inside the town or outside of town. So sometimes rational boundaries are more important than the size of the area. Today, we will have development backing up right behind many of the parcels along 2427, for example. If you look at 2427 on our west end towards Charlotte, much of our jurisdiction is one lot deep. Across the street, you're out, or behind you, you're out. And so we're going to be in those situations where there are sites that are in dual jurisdiction. If a land acquisition takes place and somebody buys 5 acres in town and 5 acres out of town, and then we're going to go through dual submittal processes where they're submitting in both jurisdictions unless they were to annex in voluntarily for some reason or another. So it's really, it gives the leadership in Midland, the mayor, the council, the planning and zoning commission, the opportunity to involve local citizens that are both internal and outside of the town limits, and to make decisions that really are better long-term decisions without making them for one sort of side of the line or the other. And there's, I know that the departments here do an excellent job. The thing is we need one department rather than two departments, I think is the way to look at reviewing subdivision plans, figuring out street connectivity, utility extensions, standards for street lights, garbage collection, coordination of services for fire and police, and so forth.
Well, we're undergoing right now, and of course we finished last year the central area land use plan.
Mm-hmm.
We're doing the Harrisburg area land use plan right now.
Right.
What would be the difference in our taking that the next step and basically doing the
Doing the
Midland
next
area
step.
land use plan and doing a joint
Well,
plan
and
at that point in time? Would that meet the same objectives, I guess, as ETJ?
I would say, no, not really, because you know more about that than I do. You went to school for it.
Well, it's a, cooperative planning is absolutely a positive.
Mhm.
I mean, there's absolutely nothing wrong at all with cooperative planning. One of the things that, just as an observer of the other planning exercises, had to do more with how did the actual regulatory side of the land development patterns in those areas come about after the planning exercise. Because the planning and making decisions about the densities and service extensions into those areas and things of that nature is very important. But once those decisions are made and the policy guide is in place for adoption, then who administers that? And that's really what the ETJ is. I think that the town would clearly be open to all the collective planning in the world, so that we can look at the types of ways to approach things in this part of the county, so we can get input from a bigger picture. I hope I'm not speaking too far out of line there, Mayor, but I think that getting input is always a good thing. However, implementing the policy is the next step, and how we implement, because that's really what I was speaking to Commissioner Carruth, is that a lot of times when development plans come in, they're going to get bounced back and forth between agencies or things like that if we've got split jurisdictions, or either we're adjacent in virtually every project. And that's what we face right now. The town's incorporated area pretty much represents existing developed areas with a few exceptions. And so the growth is not going to happen in the developed areas, it's going to happen in the undeveloped areas. And those are the areas that need for us to land on a policy that is adopted specifically for the Midland community. So I think that planning, to answer your question, is one thing. I think that administration of policy to implement growth and development and the extension of services really needs to be singular in jurisdiction.
Would it be-
And we would like, I mean, we do have areas that we've already defined in our quadrants and things that relate to the town limits. And there's areas that do butt up against that, as you see from the map, that if we wanted to work together to say, okay, is the areas that we've got defined as the quadrants and the structure there, would that be something that would work for some of the other areas that are in the county limits that's not in the ETJ? Is that something we can all work on and look towards? Does what we have, I guess, does what we have already identified work for those areas, and can we just leverage that piece of it and not have to go out and do a lot of extra work? Is basically what I'm saying, because we have it broken down into 4 quadrants in our land use plan.
The southeast quadrant is the first quadrant for a number of reasons. However, while we're planning and everything in that southeast quadrant, we're probably going to continue to see a little bit of pressure along the specific highway corridors. You know, Midland is a place that we're trying to create a better sense of community and place about as it grows and changes, as it goes from the current population to whatever the numbers are in the future. Right now, for non-local people, we're identified as sort of an X marks the spot at the traffic light. And we would like to work very diligently towards creating a place much like, you know, our sister cities here, Concord, Harrisburg, Annapolis, Mount Pleasant all enjoy. And right now, we don't have the ability to do that with our meandering city limits line.
Right. We try, but it's somewhat unsuccessful.
In your public meetings that you held, did you go so far as to discuss density areas and, you know, subdivision regulations and all of those types of things? It seems like we're maybe doing cart before the horse on this, because we don't know what your plans are for the area that, you know, how that's
Right.
going to evolve.
We
And
did,
that, you
we
know,
did
is-
ask for input, and we did visual surveys, and we also went through several other areas as far as what they would like to see or not like to see, and we broke it down into some quadrants, and we talked about the build-out and what the zoning ordinances are, and we did a lot of that discussion when we were going through our elements. So we did get some of that feedback from them, and, you know, we didn't go out to the entire county area. We took it into quadrants within our town limits, and a little bit of the extra outside there, you know, all that area in blue. We didn't have all participants from all of those places, so that was one thing we didn't do from those people from those areas.
If I could add, Mayor, in our future land use plan, it identifies key activity nodes and a series of those, and many of those activity nodes do overlay outside of the municipal corporate limits, but it does in fact identify where the citizens in the area saw density pockets. That's what the activity nodes really are. Is they're pockets of density around services and employment and other things where we have the capacity, the carrying capacity to support change and development going forward. Because we're going to see pressure. It's a matter of how do we guide that into an orderly fashion that helps us serve it in the future. And we've got a future land use map. I believe it was in our original presentation last time. I did not include it in this one. I apologize. But we do have a hard copy of our land use plan for you, and I know that it's been delivered. And I believe, did we send them a digital copy as well? We can get of the land use plan? Of the future land use?
Yes.
Yeah, so we've got, we can continue this exploration of all this detail and help the commissioners to gain more knowledge about the actual land use plan itself, the details of what the land use plan says. So this is, I take this as positive. Your interest in this is very, very genuine, and that you're genuinely interested in how well the citizens in that area are interfacing with each other. And I'm the new guy there. I've been working down there for about 3.5 months, and I've seen a very good atmosphere. I get calls all the time from people who live outside the town limits that just assume that they're in the town limits because of their address or something.
Right.
And it's a very positive atmosphere
Right.
that I've not seen in a lot of places.
Well, I think you must make a comment, is that I've just gotten, well, the incorporation was approved the year I first got elected, and I remember the way the city founders put together
Right.
the city limits, and, you know, it was a lot of controversy then about how it was done. So we talked about it, said left the city limits like an ink blot in the southern part of the county.
And one thing that we're trying to do is do a more methodical approach to all the different pieces that we're trying to put in place. So we're looking at, you know, our thoroughfares, we're trying to make sure how does that incorporate into what we want to be when we grow up. You know, all these different things. We're trying to make sure that we have all of our ducks in a row to move down that path to where we know this is what we have to do now. And in 5 years from now, we're going to make sure we have all these things in place so then we can do these other things. So we're trying to make sure we have everything together, and I think this is our first step. There's a lot of things that we can do and hope to do, but this is really, I believe, one of our first steps to moving towards that next goal of what do we want to be.
I do see, want to ask a question here, and there's a question, the same one about the land use planning, you know, would that accomplish essentially the same thing? Is that area is, the ETJ request area is so big, and when you look at it, I was sitting here looking at it, it's probably about a half a dozen areas there where one boundary or one,
Right.
you know, is surrounded on 3 sides or even 4 sides by municipal limits of just those little donuts holes, so to speak, of having those areas in ETJ, or can they be fixed with annexation, you know, and to just
Well,
annex those areas?
It's a little
more,
challenging
that's what I
on
mean,
that
that's
as
what-
well.
If we do it through annexation, then we have to wait until we've inherited the pattern for service delivery and things of that nature,
Correct.
how the street patterns are laid out, what the densities are. We actually don't have it because
Because you don't have the density right now to annex.
That would be
Correct.
if the municipality said, well, we've got to figure out this area, and define an area and annex it. It would be after it had developed to a certain degree,
So,
which is
yeah.
sort of the cart following the horse.
So essentially what,
Right.
because I know right now, there's even a local bill to close up some donut holes in Kannapolis and Concord, but that's because those areas are already urbanized areas that aren't in the city limits. Those
Correct.
two.
And that's part of what you see there. You see a lot of donut holes. We have people that, you know, their neighbor across the street is in the town limits and the people across the street are not. And that was from the original incorporation. Yeah, could we have done it a little differently? Maybe. But that's part of what we're trying to fix now.
Well, when you're talking about annexation, that was involuntary annexation, when y'all are not when you voluntary. So that if this group right here in the middle, that right there, they want to voluntarily be annexed,
They can.
you can do that without the densities. You don't need the
Right.
density.
Right.
And
That's-
and
Okay.
that's part of, we will ask if there's people that want to voluntarily annex themselves in. It's just that this will help us out in a great deal, Jay. I mean, it will.
Okay. Well-
But, I mean, we are looking at all alternatives. I mean, we do have a group that's helping us with, you know, looking to ask people if they would like to voluntarily annex themselves in. There's, you know, we're trying all different avenues,
Yeah.
but we're trying to fix this to where we don't have these donut holes, and we have other ways that we can work towards getting more and being able to bring that development and have some cohesive structure in that area. I mean, that's the big thing, Jay. I mean, we've all got issues and things in the closet, but I mean, this is part of what we're trying to fix.
Mm-hmm.
If the, to see if I could add something to, Mr. Chairman, to that. If someone owns a 50-acre tract and chooses to develop it higher density, then chances are they would need to come to the town for certain services.
Mhm.
But if their options are there to go in a different route, simply develop it under county standards, then the town is going to be getting the call down the road to, who's going to fix my pothole? Because currently, for example, the municipality is aggressively looking at how to put in place future street services. We're looking at how street maintenance will be done on a large scale over time, as opposed to counties typically are not in street maintenance business, and those neighborhood streets would be NCDOT streets. And we've already identified all of that in our most recent Powell bill update, and we have a large number of neighborhood streets that are NCDOT neighborhood streets, which are really not, they're not being maintained to the level that they need, because NCDOT needs to prioritize more secondary roads and primary state roads and things of that nature. So we're up against those battles every day of how do we respond to people who in neighborhoods that were developed prior to incorporation that have an expectation of services that we are trying to now go in and figure out what's the answer to. The problem existed before the municipality was created. How do we treat that problem? What we would prefer is to avoid the problem to begin with, and the streets be built to a single standard and then be processed through for municipal maintenance and everything within the corporate limit. One thing that may also work is something for the commissioners to consider would be certain areas that we've made this request based upon our internal assessment of the area. But if there's feedback about how this area should be configured, if it should be configured differently, we would like to hear that too. For us, it's predominantly the gaps and the holes in the services where you drive from inside the town to outside the town to inside the town within a quarter of a mile of a street. Areas where we've got services across the street from each other that are inconsistent, things of that nature. So if a more scientific boundary could be configured as well, we'd like to hear that feedback too. So my request would, I guess, would be for this to be taken under study and considered further. Because I think that you're asking very good questions. It tells us quite a bit about your concerns.
I definitely think planning ahead is a major thing to do, and I think that you'd be complimented to do that.
Mm-hmm.
But from our point of view, there's two things that come under this. One is control. Who's going to be controlling how this grows?
Right.
The second is responsibility. I would hate to just carte blanche say this is a great idea for Midland and give up the responsibility that I have currently to make sure that that's going to grow, and I don't know what your plans are. One of the positives I think that came from the Central Area Plan and the Harrisburg Plan is that it is city-county working together on making those decisions as to, what those areas, and currently, I don't know what you're planning. Currently, I would say I'm not willing to say yes to this. At this point, I'd have to know. So that someone down the road didn't say, why in the world did you, give that responsibility up?
And part of it too is, if we need to sit down and walk through that, I'll be more than happy to come and have a session with you if you'd like to walk through each of the quadrants and walk through all those elements. And, we did invite some participation and part of our study, so we can talk about that offline if you'd like, and we can go from there. So, but I really would like for, the commissioners, if you would like to consider this, we would appreciate it. And if we need to do some more sit-down and discussion, I'll be more than happy to do that too.
Well, the concern that I have is a couple of things. Is the way I view it is if we were to provide the ETJ or approve the ETJ, then we're kind of going in contrary to what our legislative goal or legislative request has been, is to stop involuntary annexations or having involuntary annexations without having people to have the voice in it. So I think we're going contrary to that, number one. Number two is what Commissioner Minot has said, is that to cede control over an area without that group or those people having the opportunity to vote for who is going to be the representative, I think is unfair. Especially, they vote for us. in the ETJ, and they asked for us to be responsible for how their zoning is going to be enforced or what's going to take place in that area. And if I'm not mistaken, that our zoning is very similar, if not the same, as Midland, since we controlled it, we did it for a long time. And if it's the same, then there's no reason to extend an ETJ or provide an ETJ. And I think also the last thing is history, is the last time that the county commissioners have done anything in regard to ETJ was about 20 years ago, if not longer. And I think that's for a reason, is that that if there needs to be annexation from a city, the city will go out and annex voluntarily, and sometimes it's done involuntarily. But I think that I have a hard problem in just ceding authority over an area without those group of people saying, yes, we agree to it. And certainly, if it's ceded, what's the incentive to annex it? If you already control it, why are you going to annex it when you can control how it's going to look and we don't have to provide services? So I think, from my viewpoint, I would not be inclined to do it because of those reasons. But we can certainly continue to go down the path to look at this if that's what the board wants to do. Commissioner Privet, do you have?
My reservations is, I have real problem with unelected officials determine public policy and ordinances for an area where they have not elected those officials.
Commissioner Minot, do you have anything else to add?
I would like us to not close the door on cooperative discussions with that area to see what their plans are and so forth, and perhaps, limit the amount that you're doing, and, I'm not opposed to discussions about it. But as I said, I'm not knowing any more than I know today.
Right. And I would love
can't
to sit
vote
down
for
with
it.
you some more.
Commissioner Poole, do you have anything?
I think most everything I wrote down, somebody's already asked or it's been addressed, so. I had a question about annexation versus the ETJ, the county guidelines, how are they different from Midlands as far as the planning, and then I think you mentioned, one of y'all did, the land, should there be the land use planning done for that area? Should we do that after we finish with Harrisburg? So those were kind of just the notes that I had jotted down. Most of those were covered. I mean, I think discussions are extremely important, just as you said, and we should keep that going. And, I would like to hear, as we proceed along this, from the people that would be affected by it, the landowners that would be affected by it, because I think their voice would most definitely need to be heard. Whether that's done with a land use plan or how that's done would be up for debate.
Right. Commissioner Cruz?
I think the only other thing that's to add is I think we do need to, like Commissioner Minot said, don't shut the door. I think we need to continue to talk about the best way to do it, because I know that we've dealt with over and over and over and over again as the community and this is horrible because I forgot the name of the community, but the community in Kannapolis that we keep getting over and over again because they are surrounded by the city of Kannapolis. They are don't have any services from the city, but all the growth took place in that area. Fishertown, thank you. And I'm sure I'll hear about that. I forgot the name. But anyway, Fishertown. And I know that if we don't, we got to do, I mean, it's going to be something we need to address sometime, because if we don't, then 20 years from now, somebody will be dealing with it in a different aspect, because you'll have an area of undeveloped, unincorporated areas that developed completely different from the areas right around the corner, up the street, and those kind of things.
Right.
I think one of the ways that we can accomplish that is once we start winding down Harrisburg, that maybe we can work with Midland and an area land use planning down there as well.
Well, and I will state, I mean, and we have finished the land use plan for the town, for our incorporated area. And I would like for us to take a look at that and understand what those elements are, and then look to see, okay, is what we've got planned for those quadrants and the county area that butts up against that quadrant. Does this still work for that area as well? Because we've actually finished ours. So, I
Right.
mean, we've done the land use plan for the town area, and I'm sure that, you know, we would like to be engaged to talk about the area that surrounds that and looking at the elements there, because we spent 2 years working on this one, and we're in the process of implementing and looking at our ordinances and trying to update those based off of that. So there will be some differences, probably quite a few differences between what we have as our ordinance and what the county has currently, once everything gets pushed through. So I would welcome the opportunity to talk about that or to update anyone if they'd like to understand a little bit more about what we did with the land use plan and how we address those quadrants. But I'm sure we would be more than happy to talk with you about the areas that are around it and see if it would work with what we have, or is there other types of things that have to be taken in consideration for those adjacent areas?
Right. Well, I certainly, I don't want to throw the baby out with the bathwater.
I don't either, because
But,
we worked too hard on that one,
But
so.
I do, and I'm not a planner in regards to land use planning, but I do think that it's certainly something we'd look at, and we should look at together.
Right.
And see, is that optimal whenever we do get to be able to sit down and look at it.
Right, and if someone wants to look at the land use plan before
Yeah.
then, if
Okay.
the commissioner would like to sit down and talk through it, just let me know, and I'll be more than happy to sit down and walk through
Mm-hmm.
the land use plan and let you know what we've done. I was a chair of that committee for 2 years, so I'll be more than happy to go through anything we have.
Thank you very much.
Thank you.
Thank you all for coming out.
Thank you for
Thanks.
everything.
Thank you very much.
How about if we take,
I was about to say that.
looks like 5:15, how about if we take a 15-minute break, actually 10-minute break, so we'll start at 5:30.
Okay.
Okay, we're back into the session, and we have G3 G3. In regards to the proposed local historic overlay district for downtown Concord. Mrs. Morris.
Good afternoon. This, used to have a memo in your packet that kind of summarized what is going on. The City of Concord's Historic Preservation Commission is taking comments on a district that would encompass what is considered downtown Concord. You should have had a copy of the map as well. The first meeting was on April 22nd, and staff did attend that meeting. The next meeting is on July 15th, and they're still taking comments. They are still taking comments, and if, on the map, you can see the district, get to the,
Nothing's working for CCA.
Let's start this back over here. We're blank screen, so we're done today.
okay. Anyway, there
There's
are
enough on the
already
agenda
two
now.
districts in the downtown. So this would encompass the two existing National Register districts and then some additional properties. However, it's only proposed to be a local district, so there is no tax benefit to the folks in the district if they're doing improvements to the properties. In that district, the historic courthouse is included in an already National Register district, but it also includes the library, which the library is not eligible for the National Register because it's only 34 years old. And in the classifications that were done during the overall study for this area, it also got a non-contributing status. So what we are looking for is some type of a recommendation from the Board of Commissioners that we can present at the meeting, whether we would support that district or not support it, or support it being applied to the county buildings or not. If you had a chance to look at the memo, you'll see that there is a process that you have to go through really for any exterior work. And a lot of times it also includes tree trimming, things of that nature. At this point, the guidelines are not set up, but if they are similar to what they use For North and South Union Street, that also does include tree trimming and tree removal. You actually have to get permission to do those types of things. And I'd be happy to answer any questions you might have.
Did you say this was, I mean, like, you know, see, the biggest structure we got is the library. The library would not, I mean, does that mean if we do anything to the library, we've got to do stuff that's historically relevant to the building or to the rest of the?
We would actually have to go through an application process for a certificate of appropriateness, which is kind of like a permit. And then they would have input on whether or not, the Historic Commission would have input on whether or not they thought that work was appropriate. And the difference between the historic guidelines and the zoning ordinance is that it is guidelines, so there's a little bit of flexibility, but they look for work that's in keeping with that time period. So the yellow outline, this is what they're proposing as the district. And then this outline right here is the Cabarus district, which that's a couple of commercial buildings and that already exists. And then the courthouse district is in here. So they're, you know, the buildings, it would include everything here within that yellow outline. And the green is actually the existing historic district.
Green. Oh, out here. Yeah.
Yes. And that's mostly a residential area. So this really is dealing more with the commercial structures in the downtown, and you can see here's the water tower.
Did they give you
So
a
here's
reason
the
why they
library.
didn't put the police department in there? Or the parking deck?
They did not, and when I asked how the lines were drawn for the district, it was just an area that they looked at. So I don't think, because one of the questions we asked was whether or not the boundary could be amended potentially to remove the library if we asked. But at this point, they're still just taking comments on the district as it's proposed at this time.
All right, I don't see any
I would
reason.
imagine it's, isn't it a historic district? Isn't that what is being
Well,
called?
I would-
And
I
the
underst-
new police stations would not.
I understand.
Northern part.
I understand the designation of calling it historic. No offense to our Concord Library, but I didn't think that was historic. It's a pea
No,
gravel building.
It just happens to be there. It's in among a lot of other historic structures.
And this would be a local district only. So this boundary reflects a local district, which would mean that the only folks who would have any type of say-so would be the Historic Preservation Commission. There would not be buildings in this area along Union Street. If they're eligible for the National Register, they're already on the National Register. So this would just simply be a local district, mainly for aesthetics, that would be controlled, you know, just by that Preservation Commission. And again, if somebody wanted to pursue tax credits, they would have to be on the National Register anyway.
Well,
I don't see any reason to have the library included, personally. It's next to the water tower, and you could say it's contingent to the area that's not being included. I mean, I would think the reason for including any of it is just to connect the current historic districts, but they're leaving their property out. The city's property is being left out. Not, I shouldn't say they, because this is the Historic Commission, not the city that's doing this, correct? Or is
It's
this
the
ci-
City of Concord's Historic Preservation Commission.
Okay. The Historic Preservation Committee.
But it's not been endorsed by their Planning and Zoning Commission at this time, and it's not been endorsed by City Council at this time, right?
That's correct. So they're just starting to take the comments.
I don't see, personally, I don't see any reason to include the library in there. I think we should be able to, I don't know that we need to have another step yet again when there's a tree that dies to get approval. Just as an example, if that's the only thing that we're talking about really, because, you know, if it's the inside of the building, they're not gonna have any control over what we do on the inside of the building. It's not a historic building on the outside, so it's not gonna qualify for anything as far as that goes. But, you know, if a tree dies in the front and we need to have our arborist go cut the tree down, then I think we need to cut the tree down.
They
That
would
would be
still
my
have
point.
control over anything that happened on the exterior. If you're in the district.
Right, that's what I mean, but I mean, I don't see the real need for that personally. The old courthouse is included, the new courthouse, the current courthouse is not included based on this boundary.
That's correct.
The- It's from the seventies, that's the historical
When-
significance,
when
it has
was
seventies
the,
architecture.
When was the library built?
The library was built in 1976.
Yeah, it was in the seventies too.
I have to laugh because I think there's a definite reason why the current courthouse is not included.
That's what I was trying to.
Because it's seventies architecture.
Give it
Same
another
as
30
the
years.
library.
Well,
Give it another 40 years, it will be significant.
I think that unless I hear something differently, I think that anything that we can possibly do to get the library out of there, it should be out. I mean, it just doesn't make sense to me why the library, Sun Trust, and right across the street, or is the Wachovia building, why is that in a historic district? I don't think that if we were not maintaining the shrubbery, then that would be one thing, is that they should be able to come in and say, hey, we need to keep it close. But to layer additional, it's just crazy. I just don't think that we should do that. I think that the library should be taken out. I can understand the courthouse, but I don't understand the creation of this district and the way it was. I think that we ought to stringently oppose the library, and personally, I think the old courthouse, because we've done remodeling consistent with that period. We've done nothing to change the outward appearance of it whatsoever.
Yeah, and what would take precedence, if you will, for the old courthouse, the National Register District, or this new district? And what I'm thinking of is just within the last few months, because I know I emailed with you on that one, that big tree out front, the limb, they wanted the limb cut back because of the monument. So does that mean that you can't cut, if it's included, we can't cut the limb back even though it needs to be cut back? Or does it fall back into the current district that it's in?
Again, they would have to write the guidelines, but if you look, the courthouse, you can see that purple line.
Let me get it bigger.
It is subject to the National Register. Now, the last renovation project that we did, to get grant money, you have to follow the Department of the Interior's guidelines for that time period. So you have to replace it essentially like it looked like back in the day. So right now, there's nothing that, the tree is not anything historic. It's a tree. The building is on the register. So the building would have to follow those standards, but at this point, there's nothing at the local level that would control the exterior or the property itself, because even on the property, in the study, the fountain and the different items out front, they have classified those as historically significant. So those would also be part of that local district and regulated by those guidelines if the district were to be placed as an overlay over that property.
Does this need to be, do we need to take action on this so it needs to be on the agenda?
I was
for-
saying if we place it on the agenda, we can pass a resolution saying, take us out.
Take us out, both properties.
Well, I don't know what this board would like. Personally, I'd say take both
Yeah, I
of them
think
out.
I'd say both properties.
Only
That's what I'm
because
talking about, but-
we're complying with the historical significance of the courthouse, and we will continue to do that. And, I'm sorry, not completely.
Not complete. That's
Okay.
what you're just saying. Correct?
No, we are, because
Well, I
the
mean,
structure
with the
is what's
structure you are,
on.
but not with the landscaping and the fountain and so
No.
forth. They're not, do not come under.
But that's been there for a long time.
But the grounds are not part of the national.
Right, they're not
Right.
part
It's
of
just the
it.
building.
So I
Yeah,
think
and-
what they're saying is we would want to include the grounds of the courthouse as way into this, so that someone in the future, some commission in the future doesn't decide to tear out the fountain and put in petunias. I mean,
Right.
I think that's what they're saying. Now, you may disagree with whether they should be the ones to say that.
Uh,
But that's not part of it.
Mr. Chairman, just one thing if I could point out, the commission meeting is before your regular meeting, so if you'd like to have something entered into the record, you would need to waive the rules for right now and take that action.
I move we waive the rules to, in order to consider this tonight.
Okay, we have a motion to
I would
waive,
second that.
we have a motion and a second to consider what plan of action this board should respond to the Historical Preservation Society, correct? I mean, is that the right name? Concord Historic Commission. We have a motion, we have a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. Now, we've heard a couple of things tonight, or this afternoon, is one, to just ask for the library to be removed, or remove the library and the courthouse from this restriction.
Well, and I see another one, I mean, I'm would be willing to make a motion that we support the idea of the expansion between the two existing areas, to connect the two existing areas, but any expansion north and south of those two areas was what we would be opposed to, just to clean it up, because it would just balkanize it so much if we start taking individual out, but in other words, see what I'm saying? In other words, the area in between the,
May I reference you to a potential motion here on page 137,
Oh.
if you'd like to look at that and
Okay.
see if that's something you would entertain?
$137.
137, it would say.
And that says contributing structures, the old courthouse is a contributing structure because it is historic.
That's correct, and it has a designation as contributing. When they do the study, they give the different properties a designation. So what that means is that if the historic courthouse, something happened and it was gone tomorrow, it would have a significant impact on that district.
And.
I'm just
sorry.
saying my personal belief is.
By contributing structure, does that include all of the property or just the building?
It's the structure.
Okay, so by this, I just want clarification of this motion. This motion would in essence say the building of the old courthouse would be included.
But not the grounds.
The grounds would not be included and the library would not be included. Is that what that motion states?
And it goes a little further to say that if it's expanded in the future, that it would still only include, or the Board of Commissioners would only support including contributing structures that were owned by the county. So this actually doesn't take a position on the district itself. It just says if there is one, then the Board of Commissioners would only want structures considered contributing that are owned by the county included.
And just for clarification, the monument and the fountain in this particular study were called out as contributing objects.
That's your motion?
Yeah.
I'll second that motion.
Okay. Is there any discussion in regards to this motion?
I want to ask
Commissioner
the
Minor.
legal eagle over there. One is contributing structures, one is contributing objects. That could become an issue in the future, correct? There could be an argument
Could
over
be an
that
argument,
word.
and I would ask for clarification from Commissioner Haruth if he meant also contributing objects and contributing structures. Okay.
I do include that.
Okay. Now, the motion that we have before us is a motion to authorize staff to write a position letter stating that the Cabarrus County Board of Commissioners only supports the inclusion of Cabarrus County properties in the proposed local district or in any expansion of the proposed local district in the future that would be considered contributing structures or contributing objects. Further, authorize the staff to attend said meeting and present this position letter for the meeting record. Yes, Mr. Downs.
I'm just asking, we're still talking, the object is the fountain in that area there. That's contributing by the National Register or contributing by what they're locally defining?
What they're locally defining.
Okay, so I guess modifications, because right now the fountain, there's no working parts of the fountain that are in there. Is this going to immediately require us to make the fountain operational again? Or would that give them the authority to do that, or just leave it in its current condition? Because it's going to be pretty expensive to make that a working fountain again.
I really don't think there'd be any authority for them to cause repair to occur.
Okay, as long as, if we do repair it, then it would have to be in compliance with their, okay, all right.
You can't let something fall into disrepair. It's already not working, is what I would look at it. We have any further discussion? All in favor, say aye.
Aye.
All opposed. Motion carries 5-0. Next one we have is G4, is the update on tip 5208 rail double tracking. Mr. Marshall.
There was a meeting held in Harrisburg, a joint meeting between the NCDOT team working on this double tracking project and the Harrisburg Town Council that I attended, as well as Commissioner White. And he asked that I give you an update on that project. I've been forwarding some of this correspondence to you since they first notified us in July of last year about this double tracking project. But this is part of a larger high-speed rail project, the idea of increasing the speed at which passenger rail can travel between Washington, D.C. and the Charlotte area, in particular to Richmond and then the area within North Carolina along North Carolina Railroad. But in addition to that, this is an area where the double tracking is intended to increase safety as well as allow higher volumes of traffic along the trains as trains become more important as a method of transport. So NCDOT has proposed a number of improvements or a number of changes. There's some argument, I would say, from the folks who were at the meeting, and it was a public meeting, that they got a little contentious towards the end about whether or not there are improvements. And of course, it's unlike a road project where people, even though they may be affected, also benefit. As this rail proposal, people along it are not necessarily going to benefit. They may, in fact, use it as indirectly because of the transport of freight and also directly as passengers, but for the most part, it is simply a rail near them that they're used to, and it's being improved. Within Harrisburg, and it really runs from an area just below Highway 49, there is actually a double track portion that comes underneath 49, but as you come towards the Cottle Creek Bridge, the second track was removed some years ago. As volumes have increased, they need to have that for passing purposes, and for safety, they need to improve some of the curves, and they also have a number of crossings that include Farm Mill Road, which you're aware is very close to 49. It has a signal there, but it's a high traffic area with a kind of an odd angle to it, so there's a problem with that. You have Shamrock Road, which also has an angle problem, but is very close to 49 because the rail is close to 49. Just down from that, there's a private crossing that, again, is right above or just north of Harrisburg Elementary to access some private properties there. And then, of course, you have the at-grade crossings, which means that the rail and the road are at the same level. So the two so you have to go directly over the tracks within Harrisburg. As they improve this for speed, it includes some angle to the tracks, which makes two sets of tracks even more difficult to do at grade. So it actually increases. They could leave those there, but it would actually increase the safety or the potential problems with that. As you saw in Alamance County, where they had the derailment some months ago, that was a case where the track is somewhat angled. It was a lower trailer was stuck and couldn't be removed before the train came through. And then, of course, there's a crossing at grade at Caldwell Road, and then there are private crossings as you go into Mecklenburg County up to 485. So the proposals, and they've gone through, and we've met with them 3 or 4 times, the Harrisburg staff, myself, and then there's been some elected officials and plus citizen meetings. But the proposal at this point, as they've gone back to look at it, they initially thought that they would leave the Robinson Church Road at-grade crossing open and increase the signalization there, as well as some lane changes or make some improvements to the road and leave that open, but close Hickory Ridge. So you'd only have one crossing within the main part of Harrisburg, and it would be at grade. So if there's a train coming through, you still have the same issues with emergency vehicles not being able to cross until the train had gone through. There was a request to look at a grade-separated crossing where you actually have a bridge. You either have the rail bridge over the road or the road bridge over the rail, so they're at separate grades, where it's an extension. This is the intersection of Highway 49 and Roberta Church Road, or Roberta Road, and that School Avenue going behind the Lowe's Foods. So there was a proposal to extend Roberta down to Stallings Road, and that's, in the latest proposal, that seems to be what the NCDOT is preferred alignment, is that you have both the crossing at Robinson Church and Hickory Ridge closed, and that you have a bridge over the rail intersecting with Stallings Road. There was interest from the residents there to continue that extension on down to Hickory Ridge. I frankly think that would be a great benefit to us with two school sites just to the south of that. I think it also helps with the overall network. There were a lot of valid points made by residents that right now you've got traffic coming up Robinson Church and up Hickory Ridge, so you have two options going north-south from Harrisburg. This is going to be the only one, and at this point, the only way to get to it from Robinson Church is really two turns. That's would stay in place even if it was extended to Hickory Ridge, but it would improve that there would be at least some redundancy there. And you also wouldn't have, at this point, if it is not extended, you'll have folks coming up Hickory Ridge needing to go right and left, people coming up Robinson Church needing to go right and left. If it's extended to Hickory Ridge, then you'd only have one of those movements. There are, of course, issues along Stallings Road. This is actually their park site. The elementary school is just off the map here, but there are issues, of course, with some flooding of Stallings Road. So those are some things that people brought up as concerns. The other major issue that came up, really, or the other one I think is a major issue that came up, is at the point of for Farm Mill Road, and this is actually the intersection of Shamrock Road and 49.
Too far.
Right off the map. I thought my pointer was shaky. This is Saddle Creek and J. Howard Enterprises both use this right now. That's the Saddle Creek Industrial Park, and they're using that. And this is a major distribution center with a new building that's just been or just being completed. So they're using that access to 49. Under this proposal, that would be closed, and those trucks would then have to use Shamrock Road, using Shamrock Road both east and west to get back to Far Mill Road, and then they would come up Far Mill to intersect 49. There are some valid points when they did the traffic study. Currently, as you can imagine, there are a great deal of vehicular traffic that uses that as a cut-through. So they have very high traffic counts with cars and other vehicles that use that as a cut-through to Far Mill Road. That would be eliminated. There'd be no longer any reason or any benefit to turning onto it from Far Mill Road. You wouldn't be able to get to 49. So it'll eliminate all those vehicles during the day. What it will do, however, is cause all that truck traffic from J. Howard and from Saddle Creek to use it as their only way in and out. And those are really a lot of times at off hours. That's a distribution center that distributes things like bread that goes out first thing in the morning or in the early morning hours. So you would have increased traffic in the early AM hours, but decreased traffic for the rest of the day. They are proposing, this is the current intersection. There's a speed rail industrial park also, so that's Speed Rail Court and Far Mill. That's an at-grade crossing that has had some accidents. There's a lot of really heavy industrial use here, some hazardous materials that are transferred in that area. So they're proposing that would be closed. They would relocate Far Mill Road through the salvage yard and create a grade separation there. So there'd be a new bridge and then the access back to 49 on the north side of 49. And that's Blackwelder Road, so it would connect to Blackwelder. Again, there are concerns that they're looking only at the improvements right there at 49. That's going to put a lot more traffic on Blackwelder Road going to Roberta, so it's really going to increase some north-south traffic there. But again, it offers a grade separation area and the ability for Harrisburg in particular, as the main service provider and for REMS, to have a grade-separated crossing for emergency vehicles, which is important, but particularly as the train traffic increases. And the private crossing that I talked about would be closed. You know, there's been discussions with the Board of Education about those properties which are right in here, accessing the drives at Harrisburg Elementary and getting out to Stallings Road that way. The concern is, of course, in the morning and afternoon, those are stacking lanes for people dropping and picking up their children. So DOT has actually looked at part of this project adding an additional lane to go in and out so that would alleviate that, so that the folks who have, well, it'd help with the congestion in the school in general. It would help with the operation at school, but it also allow these folks to get in and out during school hours. That is the proposal right now, to eliminate that private crossing. And then further to the west at Caldwell Road.
Let me ask a question.
Okay.
before you get over there. For the tractor-trailer traffic,
Mhm.
can that road handle the tractor-trailer traffic? Or
I-
are they proposing to widen that road all the way out so that it has better
See, I was,
design for tractor-trailer trucks?
see, I was going to suggest that.
There are really a number of issues with Shamrock. There are bridge crossings, and the question with some smaller creeks, whether or not those can handle the traffic. And there were residents who brought that up, that when that industrial park was originally approved, that they did not permit that traffic to go that direction because of load limitations. So that would tell you that they would have to fix those bridges. In addition, there is some question, Richard Hancock, who's the deputy engineer at the division, was there, and there were some questions to him about whether or not the road at surface itself could support that traffic. And I think it's something they're going to have to look at. And then finally, where Farm Mill and Shamrock intersect, there's some questions about the geometry there and the ability of that intersection to handle turning traffic. So they need to look at that too.
My question on that same topic is that, the property along Shamrock, most of that's still undeveloped property. Is that all zoned industrial?
It is not. Currently, it's residential. In the area plan, the proposed land use right now is that this would stay in the very low density. Is that correct, Susie? The area along Shamrock, some of that open farmland would stay in the very low density because of the flooding issues and how flat it is. That for now, it's not proposed for very high density at all.
Mm-hmm.
I had
I see that.
suggested to them one alternative, and if you're familiar with the Lance facility off South Boulevard in Charlotte, there's a bridge off of South Boulevard going over double tracking, and including the light rail that accesses Lance. It is at a very odd angle, but it really just serves that facility. And I had sent them an aerial photograph of that, and as well as a county tax map showing, a similar layout here. In their analysis of it, because of the amount that they would have to span those two, the distance they would have to span, how close it is to 49, and the overall cost they eliminate, they did not feel like that's something they could do. They estimated it would be at least $15 million just for that one improvement. At Caldwell Road, they're also proposing a grade separation. Currently, of course, that's an at-grade crossing right now. A fair number of people use that as a north-south access or from 49 going south. As there's been development proposed north of 49, there's been talk about extending Caldwell Road all the way to 29, which I think will happen sometime in the next 10, 15 years as those properties develop. So you will probably see, this is Caldwell Road right here. And again, that'd be grade separated. There's also a crossing at Millbrook, which is an industrial area, but there is some residential at the very end of Millbrook. The Millbrook crossing would be closed. They would actually extend a road that exists off of Caldwell that goes into another industrial park. They would extend that road up to pick up all the properties that currently are accessed by the southern end of Millbrook. So they would then be collected and come back to Caldwell and get back to 49. That road would actually extend into Mecklenburg County to 485. There are some farms there as well as a Duke Power substation. There are, I think, 3 private crossings that it would eliminate by extending that private road. There was some concern by one farmer who owns that property about the potential development of his property in the future, and they said they don't preclude another grade crossing, so if his property was developed, then certainly whoever was doing that could build another grade-separated crossing, because there is room between 49 and the track to do that, or it would have to come back out this access road. But all that would be picked up and come to Caldwell Road, so there didn't seem to be a huge issue with that. There was some discussion about a plan. At one point, Stallings Road was shown. This is Robinson Church and Stallings Road right here. There was a plan at one point to extend a parallel road to the Harrisburg Industrial Park here and connect those two, which would give you some more alternatives. That's really, it's been shown on the thoroughfare plan to do that. There is some benefit to that, but it's really outside of what the improvements that I think DOT and North Carolina Railroad would propose making in this area. That's really more up to the town of Harrisburg to ultimately make that improvement, or DOT, the division. They are intending to, they've done all their environmental studies. They've gone back and they're looking at the comments that were made that night, and they're intending to come back with their final proposals. The schedule as they have it is that they would hold another public hearing this fall, which of course I'll pass that along to you when that public hearing is held. In winter, early 2011, they would have their final environmental document, which is that FONSI, or Finding of No Significant Impact, and then begin right-of-way construction in 2011. And this is all tied in with some larger issues, with some other track improvements. You're aware there's some in Rowan County. This is all part of the larger high-speed rail, as well as improving the freight capability for North Carolina Railroad.
How long does it take to, if they started then, to actually finish all this? What is the projection? How many years?
Commissioner White, you were there when they answered that. They had indicated they would be finished by 2015. So, yeah.
Relatively quickly for this,
Yeah,
for this
that's-
size project. You know, just with as much information, with as much as going on over there, I thought it was important that we understand what all is being discussed regarding the rail closings and or possible cross closings.
Let me ask a question, and I probably should know better than to ask this question, because the planning, the synchronized planning at DOT. I know that Concord's been expressed interest in trying to find some alternate traffic relief for the mall area. Just northeast of that is the Speedway property. You've got, you know, Bruton Smith Boulevard. They're talking about doing another separate road go to 29. Has there been any discussion of that, how that could tie into Speedway Boulevard and provide the alternate, the Caldwell Road and Millbrook in that area?
There has been, and again, it was part of that EPIC development. They showed Caldwell Road extended. As part of the Moorhead Road improvements. There's been some analysis of how it could all tie together.
You know.
So over the years, there has been, it really is very rough topography. That's probably the biggest difficulty, but as that property that's along Hudspeth Road and the area surrounding that, when people looked at development, then there has been a north-south route discussed that ultimately would take the traffic off of Moorhead Road, at least that traffic south of 29 on Moorhead, take some portion of that and move it over to a new road and access 49 that way. The other piece of this that could ultimately affect the residents in a positive way is a commuter rail, and we've had some discussions about a study to look at commuter rail along here, since there is an existing station in Kannapolis, rather than building on a new track. This does allow, with the double tracking, a greater opportunity for that. There has been a study, and we heard about that at a Progress in Motion session in Raleigh, about a study that was performed on a section of North Carolina Railroad, particularly from Burlington to Goldsboro. Is that right, Mike?
Yes.
Where they looked at commuter rail there. I think it certainly would, I think they need to do a similar study here, and we will be asking them to do that.
I was thinking that since it is going to be a double track, why not start talking about it now, so that when it's definitely needed, it gives us the opportunity to use that instead of building light rail or being talked about building light rail up here when that's not necessary. So-
And during this process, there has been discussion, they've talked about the possibilities of commuter rail with these improvements.
Okay.
Anything else?
It's got a little button on the right up there.
Well, Mr. Marshall, if you'll just keep us up to speed on this, I certainly appreciate it. I think it's important us to know what's going on over there. Thank you very much. Next matter we have is G5, which is the Far Mill Park voluntary annexation to the town of Harrisburg. Mr. Day. Mr. Downs.
In your May meeting, you had agreed to Harrisburg, the town of Harrisburg's request for them to take ownership and to take over maintenance and operation of the Far Mill Park. As we did more research into that, due to the county having secured part-if grants and other grants related to the construction of the park, we were not able to transfer ownership. However, we are able to lease the property to them, and our county attorney, Mr. Cook, is preparing documents for a 25-year lease with an additional 25-year option. Since the town will not be owners of the property, and they are asking that the county request voluntary annex into their town limits.
Okay.
And it's for several reasons. They want the park to be in their town limits because they want to call it a city park. They also have intentions of incorporating that Canterfield subdivision right next to it as well.
And they're still going to take over operational costs of the park.
Yes, sir.
We have a motion to place this on a consent agenda.
So moved.
We have a motion, we have a second. All in favor, say aye.
Aye.
All opposed, motion carries. G6 is the donation of 38.96 acres to the town of Harrisburg for the exclusive use of the Parker Greenway.
That's correct. This item here, if you'll turn to, it's on page 165, there's a map. Make sure I get this here. This piece here is the park itself, and this is the Canterfield subdivision. These hashed lines here are under the county's ownership right now, and they were in place. They were part of the subdivision that came through, and part of that, they donated them to the county for potential greenway and open space. The town of Harrisburg is open to take those as well, and in the future they would develop them, and therefore the county would not have to develop them. They would pay for the development of those properties. There is a gap in here, but that would be Harrisburg's responsibility at a later date to try to close that gap. This is the river running along through here, so you can see that those properties are adjacent to the river and prime property for a potential greenway space.
The park is there?
Park is
Right here.
Right there, that's what.
Yes, ma'am.
Sorry, I looked up or down or something when you pointed.
Yeah, it's right there. You can see their city limits come up in right here, and their city limits are already here. So they're trying to take the park as part of their park system, include this subdivision. They would have to involuntarily annex that in, but then they would have these parcels here as well. If the board chooses to donate the property or transfer the ownership, then there is no need for us to voluntarily annex that property if we have to do it through a deed again, which there are no ties to any other grants, so we don't have to. So if the board chooses to go ahead and transfer the property rights, there's no need to do the voluntary annexation for that site. If they choose to do the lease, then we would have to voluntarily annex that site as well.
Did we purchase this property? Did we
No,
purchase?
we did not. It was donated by the developer.
If we transfer it to Harrisburg, we have no control over what they're going to do with it, but their intent is to keep it the same as
what we would put in as Mr. Cook would
The restrictions.
create that, would restrict it. It would
Okay.
either be a greenway or a park. That would be the only thing that they would be able to use it for.
Any other questions? Have a motion placed on a consent agenda?
Second.
We have a motion, we have a second. All in favor, say aye.
Aye.
All opposed. Motion carries. And the trifecta.
Okay, this is the third one here is the park property itself. The information, Kate, can you locate that for them, the map? We're talking about the current office building that our Parks and Recreation offices are located in. It's in your supplemental information there. We didn't get the drawings till later on. I actually have some hard copies if you. How much? 219. Okay. Yeah, good. We can't see this very well. These maps are not very well, are easy either.
No, just wait.
This is Lake Concord. Well, it was Lake Concord, right? Go up a little bit farther. There you go, right there.
How's that?
Yeah, this is Lake Concord Road. This is our existing parks office right here. The current property line is right here. It runs right on the edge of the building.
No drip line.
Therefore, these parking spaces are on the property of Ike's Construction.
So we need to get it all.
And these signs. So what we're proposing to do is to purchase this strip here and transfer this property over to Ike's. So it's a net result that we would have to buy
0.107.
0.107 acres. The tax value on that is just a little more than $20,000, $4.50 a square foot. They have agreed to sell us that strip, that net strip, for $15,000 even.
Any questions for Mr. Downs? We have a motion to place this under consent agenda. We have a motion, we have a second. All in favor, say aye.
Aye.
All opposed. Motion carries.
Thank you.
Next matter that we have is, and BO is the BFI fuel surcharge update, page 169.
You'll recall there was some discussion about the multiplier that's used for the fuel surcharge, and BFI had offered the opportunity to do a monthly or quarterly change based on what the actual cost is as reported by the federal government. And you had asked for this to be reviewed again in the future. I think the first time we looked at it, it seems like there was, while the agreement calls for a 7.5% surcharge, if we were using the actual number, it was going to be 2 or 3% higher than that. In the case right now, it would be 1% lower. And the board's decision at the time was that it's probably better to keep the stability, and it looks like we've got an arrangement that's going to put us on the better side overall on the average. And it looks as though that's probably still the case. So it's only 1% off now. People came out way ahead 6 months ago when we looked at this. So this is just a report for information. If you want to discuss it or consider it, you certainly may.
If we agree to go, or ask that we go to 6.5%, then we're locked in at 6.5%.
No, actually, if you scroll, let's see, scroll down to page 175. And this is the chart that would be in effect based on the date in which we first entered into the agreement with BFI. So you take, using the at least but less than columns to determine what the actual diesel price is, then you move over to the next column to see what the fuel adjustment percentage would be. Up in the beginning, I guess on the first page, we had included what the current numbers are now as reported for the lower Atlantic area and over the last few months. And that was on page 169, and then on page 174, there's a chart showing the changes in that number from December 2007 up till
Now.
Basically now, right?
Well, it seems like the better business decision is to keep it like it is. I mean, we're going to have some fluctuation, but if we're steady in the price, then over time, it'll probably be the better thing we do.
I think it's unlikely that diesel's going to drop a whole lot more. think it's more likely that it's going to go up.
Unless anybody wants to put it on the agenda to discuss, we'll just leave it as is. Okay. Let's see here. And with that, is there a motion to place the remaining items under the appointments, under the minutes, everything other than what we've discussed onto the agenda as it's presented?
So moved.
We have a second? We have a second. All in favor say aye.
Aye.
All opposed? Motion carries. Is there anything else that needs to come before our board? Do want to let y'all know, at the last CVB meeting that I had, we talked about a marketing plan of the area hotels and restaurants that I've asked them to prepare and give it to us so that we can see it. So that will probably be coming at our next board meeting. On the next board, that's August 2nd. At the next work session, August 2nd, I plan to be on vacation, so I'll not be here on the next meeting, just to let y'all know. So, anything else to be discussed? Do we have a motion to?
Just remembered. Sorry. Kay had pointed this out to me. I guess I am the only commissioner going to the annual conference.
I make a motion that Bob be our voting delegate for the
But I'm
annual
not sure.
conference.
That's why I
Second
want to
that
bring
one.
up, I will bring up that I'm not sure if I can be. I need to check with our legal counsel at the association, since I
To
am
the
an
extent that you
employee.
can be, I make the motion. that you be the delegate.
I second that one, to the extent that he can.
We have a motion, we have a second. All in favor, say aye. All opposed. Motion carries. That's unanimous, 4-0.
Yeah, the railroad, we were just talking about that railroad, you know. God.
Is there anything else you want to discuss?
No,
Bob?
that's quite enough, thank you.
Oh, now do we have a motion to adjourn?
So
We have a motion, we have a second. All in favor, say aye.
Aye.
All opposed. Motion carries.
I'll
Thank
check
y'all.
that.